Have you felt restless, anxious, or scared by triggers? Triggers are something that we see, hear, smell, touch, or taste that remind us of a prior traumatic or stressful experience. Maybe you've noticed that you feel anxious when you pass a restaurant that you used to enjoy with your ex, or hear a song on the radio that was playing when one of your loved ones passed, or going to a hospital reminds you of when you were sick. These are all examples of triggers. Triggers are typically followed by a restless feeling, an anxious reaction, increased heart rate, sweating, feeling shaky, even re-experiencing the event. A natural reaction to triggers is avoidance. Most people try to avoid triggers so that they avoid those physical and emotional reactions. But over time, this avoidance becomes a habit, and it actually strengthens the triggers. They have more and more power. And individuals find themselves avoiding more and more situations, and their distress generally increases, and they may find their world shrinking and being overly cautious of what may or may not set off a trigger. Unfortunately, we all have triggers, but triggers are incredibly individual. So you may have heard when you're triggered, or maybe you've had panic attacks. Maybe your friends or loved ones have said to you, just calm down, it's okay. Or just calm down, relax, it's all in your head. Well, all of those statements clearly are super helpful. Unfortunately, they're not. If it was that easy, you would have actually been able to do it probably, right? Here are some strategies that can help manage triggers. Monitoring how often, when they occur, as well as how severe your reactions are when you are triggered, is the first step. Oftentimes, when we are feeling distress, we tend to overgeneralize and just think this distress is happening all the time. So what we first want to do is just actually get a baseline and monitor daily how often this is happening, and if it's not happening at all, because you want to actually begin to have a very clear and very specific and realistic understanding of how impactful these triggers are in your day-to-day. You're really going to want to begin to heighten your awareness of examining your generally first physical reactions, heart palpitations, sweating, shaking, or behavioral reactions, avoiding people, places, events, songs, foods, as well as your emotional reactions. Some people actually just get numb, and others get incredibly scared and panicky. You're going to want to actually look at those reactions. Those are all around this trigger. And then you're going to have to figure out, okay, which one can you control? What you're going to want to do is learn new strategies to gain better control of your physical, emotional, and behavioral reactions to these triggers. So this is where mindfulness and cognitive behavioral techniques, where you're beginning to control your thoughts, how you're thinking about this trigger, or the memory you have around it, as well as your perceptions of your ability to actually control your reaction, as well as your reaction itself. Next, what you're going to want to be doing is apply these new strategies in your day-to-day. You actually have to get these strategies down so that you can then, in the next step, begin to actually, bit by bit, expose yourself to first some of the peripheral, some of the outer areas surrounding these triggers, and then bit by bit getting closer and closer to this trigger and being able to apply these new skills and strategies to control your reaction. What you'll be doing is actually training your body, teaching it that you do have the resources to cope with this trigger, that this trigger doesn't have power over you. Over time, the trigger will lose its power. It's not that you forget that this happened, and it's not that it doesn't mean anything in your life. It just doesn't have to negatively affect you the way it did. This all is really easy to lay out But if it was that easy, you probably would have already fixed this, right? This is where therapy comes in. And when I work with patients on managing these triggers, we're going to take it step by step to figure out a way that is in line and authentic with you. So if you're interested in gaining better control of yourself when faced with triggers, feel free to schedule a free 30-minute consult with me so we can explore how we might work together. You can schedule a free consult at www.drcatalinalawson.com.